I'm Dan Baldwin. I'm the president and CEO of the Community Foundation for Monterey County. And I'm just going to give you the briefest of welcomes. And because we have an illustrious panel, and there's going to be a lot of information, and we're going to compress it into a fairly small amount of time. But we knew very early this year, particularly coming out of our board retreat, which is held in January, that we needed to have some sort of response to what we could see as a lot of looming anxiety, and especially in our immigrant community, and how best to equip them with what to do in certain circumstances, and knowing their rights, and reducing that level of anxiety. And it took us a while. We came up with the name of the fund fairly quickly, but I want to give a shout out to our partners at the James Irvine Foundation, because they immediately wanted to help seed the fund and give it some critical mass. And of course, their process takes a little while. And so we didn't actually announce the fund until their grant had been secured. And so that was relatively recently. And then we now are making it better known to the donor community and the wider public that this is a fund that can all support. We've expanded the one of the criteria to assist with mitigating food insecurity, given the recent stoppage of SNAP benefits, which may come back. We don't know if they're going to come back all the way, but that's also part of this fund. So the Community Foundation is very, very concerned always with trying to assist everyone in Monterey County, but I think most particularly those that face the highest barriers, and so that's a lot of what Supporting Our Neighbors Fund is about. And so thank you all for being here. I'm going to turn it over to Cecilia Romero to moderate.
Thank you, Dan. Welcome, everyone. Before we start today's conversation, we're just going to make a quick round of introductions. So first, Dr. Chris Dunner. Chris is professor of sociology and the founding faculty research fellow over at the Institute for Social Transformation with UCSC. Chris has been a great partner with the Community Foundation with many of the efforts that we lead, including citing. Thank you, Chris. Norm Groot, executive director for the Monterey County Farm Bureau. Norm has led the Monterey County Farm Bureau since 2010. Thank you for all the work, Norm, and thank you for being here today. He received many different awards, and we're also just delighted to have you here. Thank you. Elsa Mendoza Jimenez, director of the Health Services for the County of Monterey. Elsa has been a public health practitioner for 25 years and led the County of Monterey Health Department since 2016. She serves on many boards, including chairing the Community Foundations for Monterey County's Board of Directors. And we also have Michael Castro, who's the Director of Community Initiatives and Partnerships for the Community Foundation for Monterey County. Michael has been with the CFMC since 2018 and leads all of our community impact efforts. Thank you, Michael. All right. So again, thank you for being here. We're excited to speak on the community needs and also tell you more about supporting our neighbors and how philanthropy can come together and help address some of our community needs, particularly those felt now by Monterey County residents. And so we'll start the conversation with Chris, who will help anchor today's conversation. And Chris will walk us through sort of the economic patterns that have led and shaped Monterey County to where we are now. Then Norm will follow, speaking to the impacts felt in the ag industry and what that looks like, what these policy shifts look like for the day-to-day of the work that you help lead. And then Elsa will then speak to the impact of just the Monterey County residents overall. And then Michael will jump in and speak to some of the challenges that some of our nonprofits are facing today and how supporting our neighbors aims to help aid some of those challenges. So Chris, thank you for getting us started.
There we go. Great. Thank you. Thank you so much for that introduction, Ceci. Thank you all for coming here. I also want to thank the Community Foundation, in part for starting this event with economics. Usually economics is the thing that you bring on when people are ready for their afternoon siesta or nap. The kind of person who becomes an economist is someone who's very good at math, but doesn't have an engaging enough personality to become an accountant. So I'm going to try and bring data alive to really help us all understand the waters we swim in, sort of the broader term economics, in which some of the more recent issues that Norm and Elsa will be talking about, and Michael, that are really kind of animating our work at the moment. But the key thing is to recognize, often we think about what's happened in the Trump administration as raising economic uncertainty and creating certain challenges. But our economy has been suffering really for the last 50 years, in which we've had economic growth, and that's that top line, of roughly 240% increase over the last 50 years, inflation adjusted, like real growth per person, where wages have stagnated. Essentially, we're seeing growth disconnected from labor. What does that mean? Higher profits, higher returns on the stock market, higher returns to executives. And that's even despite labor productivity. That purple line there is the output per hour of work. Lots of stories I could tell you about what those different lines tell you about different gender patterns, but part of it is a point to some of the increasing economic insecurity that working class males in this country have felt over the last couple of decades, that's fueling the kind of dissatisfaction with our political elites, really across both parties over the last 15, 20 years. This is a chart that shows how much of that income increase is really captured in the top 0.01% of income earners. I just saw this statistic yesterday, maybe you all saw it too, that if you figure out Elon Musk's new compensation package, $1 trillion if he meets particular metrics, comes out to more on an annual basis than all of our elementary school teachers in the country combined. That's just a capture of how unequal our income distribution has become. And the critical thing, and this was another statistic that kind of blew me away, is if we had just managed to keep in place the same level of economic inequality we had in 1975, which wasn't great, but was a lot better than it is today. Just keeping that income inequality with the growth in our economy, $79 trillion more would have gone to the bottom 90%. It's about $4 trillion a year that would have been available for most of us as spending resources to deal with some of the affordability challenges. But beyond the economic inequality are some of the challenges of the way our economy has restructured. And traditionally, access to higher education has been the pathway to the middle class, to economic opportunity. What's happened over that period of time is that as we have underinvested in higher education, tuitions have increased, there's less public investment. Those top three lines are showing how much tuition has increased across the country in four-year in-state institutions, private, nonprofit, as well as the community colleges that have gone up pretty dramatically. And the rewards of higher education in the labor market have stagnated. That bottom line is essentially the percentage more you can expect to earn with a college degree compared to someone with just a high school degree. And we know the level of student debt that students have incurred as they have tried to pursue that higher education. One of the lessons of this, by the way, is the governor has a plan, a master plan for career education, which is really trying to emphasize experiential education, vocational education, really linking much better our K through 12 system with our community colleges. I think that's absolutely the right direction in terms of thinking about economic opportunities. But part of what's happened over these last 50 years is that American dream of, you work hard, do well, and your kids are going to be able to do better than you do, That used to be true for over 90% of families in this country. It's now down to about 50% of families who can expect their kids to earn more than they can. So there's a level of economic desperation out there that, I think of as kind of like the frog in the slowly boiling water, right? We don't appreciate how difficult it is because it's been this slow process. But one of the most heart-wrenching statistics that gives an indication of that is what people call the deaths of despair. And this is where the healthcare discussion becomes so important, is this has to do with deaths related to alcoholism, drug abuse, suicide. Got a lot of publicity with a study almost 20 years ago now that was documenting that in white working class communities across the country, much of it in Appalachia, where in fact life expectancy was declining in white communities. Recent evidence has shown how much of those, quote, deaths of despair are going up in Black communities, Hispanic communities, and has always been much higher in our Native American communities as well. See, this is the inspiring part of the story. The rest of the panel gets to tell you what you can do about these challenges. I want to shift gears now to talk a little bit about our local context. And I always like to start with a reminder of who are we in Monterey County. These statistics actually include San Benito counties because of the nature of the statistics, but it's much smaller. So it's really mostly Monterey County. An increasingly diverse population. We're now about 75% people of color in the county. Roughly 60% are Latino. Over a quarter are immigrants, foreign born. Latest statistics I've seen is probably about 11 to 14% don't have full work documentation. One critical aspect of that we talk about as the racial generation gap. And what that does is it looks at the demographics of the over 65 population compared to the demographics of our future workforce, the under 18 population, where in our over 65 population, almost 60% are non-Hispanic white. And it's reversed in the under 18 population, where only 15% are non-Hispanic white and 85% people of color. Why this gap is important, and this gap is one of the largest in the country, is that we have data that shows where that gap is larger, communities tend to underinvest in youth programs, in education, and related efforts. And the reason for that, you can see, is like those who are over 65 tend to be more civically engaged, tend to vote more, tend to be more active, tend to be more the donors in the community as well. And if there aren't connections where they see themselves in the younger population or have programs to connect across those racial divides, there tends to be an underinvestment in that area. In our region, this also has a geographic dimension as well, where the retired non-Hispanic white population is disproportionately on the Monterey Peninsula, and our future and current workforce is disproportionately in the Salinas Valley. So how do we overcome those geographic divides as well as racial divides? Our economy in the region, I was just talking to Norm a little bit about this earlier, about it's a widespread recognition about how important agriculture is. It's almost 30% of jobs in the region are in agriculture. You combine agriculture and hospitality, it's about 40% of jobs. Those are the huge industries. But healthcare and social assistance is the next largest category beyond the public sector. It's about 11% of jobs and almost a third of all jobs for women. So it's really important to keep that in mind, the importance of the healthcare sector. This chart on the right there is brought to you by the American Optometrists Association. If you have a hard time seeing it, check the prescription. It's really trying to look at the level of part-time and seasonal work. And the key thing is those kind of gray bars are the percentage of total employment in the industry that are full-time and year-round work. And what you'll see is those bottom two categories, accommodation and food service, hospitality industry, and the agricultural industry, have roughly a third of the jobs in those industries are actually full-time, full-year jobs. The rest are some form of part-time or seasonal, which is really critical. That's also true in the healthcare and social assistance area where there's a lot of part-time work. Some of that is seasonal as well. So it creates a huge challenge for people of not, even if wages may be okay, they're not earning full year. And we have a very high cost of living in the region. I know that's a surprise to all of you revealing that, but yes, we do. It's estimated that just supporting yourself without any children requires a wage of almost $35 an hour at full-time, full year to afford a reasonable cost of living in the area. And that's way above, by the way, the state minimum wage. It's way, way above what the federal government defines as the poverty wage, official poverty wage, which is why we like to look at double the official poverty wage as a reasonable kind of level of economic hardship. And what this shows, this is across our whole region, including Santa Cruz County, the percentage of populations that are earning below that reasonable poverty level. Over 55% of our Latino population in a typical year, with some of the additional supports during the COVID pandemic that actually brought it down to only 35% in the Latino population in 2021. But keeping in mind those racial differences of economic hardship, I think is really important. So with those inspiring words, hopefully that provides context in which we're having serious conversations about the challenges that we face in our community. And I'll turn it over to Norm.
So Norm, Chris just sort of walked us through who we are, where we are. And of course, when we think of who we are as it relates to jobs in our region, we think of the agriculture industry. So what are you seeing?
So good morning, everyone, and thank you for being here today. And I will provide an overview perspective of what's happened in agriculture since January, essentially. Oops, hold on. Message here, it's blocking my view. Okay. So I want to start by saying that, there's been a lot of talk about immigration enforcement, particularly in Los Angeles and other areas of California. We have not had immigration enforcement like that type here in Monterey County. We've been very fortunate. There was a time in January after there was some enforcement in Kern County where some farm workers were picked up in kind of a larger situation related to a criminal activity that was going on. And that caused some fear in our community. And we really thought that with the attitude of Trump versus California, that we would see that here. We are a big target with 55,000 people working in agriculture every year here. We thought for sure that we would be one of those targets. Well, it turns out that, from my perspective, I see that Trump values our food supply. I mean, we produce a lot of what ends up on our nation's dinner tables every night. And we're important to that food supply. And so I'm thinking from our perspective that Trump has maybe made a quiet decision to leave the larger areas that are producing a lot of the fresh vegetables, leafy greens, and berries that end up on our dinner tables. So that's our perspective at this point. We're, of course, still on vigil and watching for sure. We did have a few criminal activity enforcements early in the year. And quite honestly, those were people who didn't belong in our communities. And we were happy to see that they were at least looking at it from that perspective. But the fear in our communities was tangible, very much so. And oftentimes with our workspaces in the fields where there are no fences or barriers protecting those farm workers who were in those fields, we had some concerns. But in January and February, we're not producing a whole lot here. We're still pretty much active in the desert area of Southern California and Southwest Arizona. So we did not have a lot of farm workers exposed at that time. However, we do have a community here that was extremely concerned. We also found that the farm worker housing that we provide, we've built over 5,000 beds of farm worker housing in the last 7 years. That provided a safe haven because it's on the property of the farmer operation. And so it can be protected and it does have legal rights to those protections. So that offered a safe haven to back to work here in the spring. We also saw a lot of cooperation with our local law enforcement. I was in contact with a lot of the police departments as well as our sheriff's department on how these situations would be handled if it comes up and does arise here. We had a larger community that was collectively talking about this on a week-to-week basis. And so we understood that we were getting that support from our local law enforcement. We also help with the distribution of the red cards to our immigrant community, as well as those in the community who needed them. I believe we distributed over 120,000 red cards here in Monterey County, which was quite an accomplishment in a very short period of time. We had most of those out by the beginning of March, which was pretty incredible. But moreover, it was also informing the landowners and the farming operations of their rights should La Migra show up at their gate or on their field, and educating them on what they can and cannot do. And that was fairly enlightening to a lot of them because this was a new and different situation. And as a result, with open fields, that enlightened a lot of the landowners themselves too. But moreover, operations that were fenced were able to close their gates during the day and make sure that their farm workers were protected with some sort of barrier that the enforcement could not just drive onto their property. We also highly emphasize the fact, that they need to have a search warrant and have a specific target in mind. And so there were a lot of meetings with the landowners and the farm operators, as well as getting that information out electronically. And I think that really helped ease some of the fear in the community as we transition through the spring season and into the summer. Do you want me to go into the small farms impact too? I think that is particularly important as we see that smaller farms are becoming less capable of handling the personnel situations on their own. They just don't have the resources. And so they're relying more on farm labor contractors. Those farm labor contractors have the ability to bring in H-2A workers. They know the system, they know how to work it. It is not a cheap process and it is not easy. And so it takes away that burden, so to speak, on our smaller farms. And so what we're seeing is the small farms have just a small core group of employees almost year round, whereas the harvest crews that they need or other field work is contracted out to labor contractors. And that's really a big change in the dynamic of how we're handling our labor supply. Not only from the aspect of outsourcing it, so to speak, but also from the H-2A perspective, where we are seeing that H-2A is increasing slightly every year as a reliance on labor because we are aging out a lot of our farm workers currently. And that is the supply that we see. We are not getting those immigrants moving into California to take those jobs. Let's see here. Labor is also getting much more expensive in California. We do have a high minimum wage, and here in Monterey County, we pay well above that minimum wage simply because of the competition for labor and those 55,000 people that we need every year to harvest our crops. And so we are providing a better economy for our labor, and it is expensive to manage, as well as all the workplace rules and other items that come along with that. We do provide a lot of health insurance in agriculture now, and so that is a selling point when we're looking to hire employees. That's all part of the package. But resources are stretched very thin right now. This has been a really rough economic year for agriculture locally. Markets were not good. We all know what's going on with trade. We all know what's going on with the increased costs of regulatory compliance in California, which I'll just mention. We did a survey earlier this year. It's now $1,600 an acre for regulatory compliance in agriculture. So that is one of the impacts that we're seeing too. Beyond agriculture, we also were working closely with the food banks here. They lost a lot of the programs and funding this year. And so we were trying to figure out how we could get not only more supply, but more funding into our food banks locally. And that led to the food security question of a lot of our farm workers and how they handled that. And I'll just say that California's environmental regulations are getting far more complex for agriculture here in California. And a lot of those new rules and laws that are passed in Sacramento are almost contradictory to others that we have already in place. And so it becomes very difficult for small farms to manage that process going forward and remain in regulatory compliance and do all the reporting that all the different 21, 22 different state agencies require reporting for now. So I'll leave it at that. We can follow up with questions later. Thank you.
Thank you, Norm. So Elsa, so we heard from Norm, you know, a lot of the sort of fear sentiment, right, that's being dispelled by mostly education, both for employers and employees, and sort of the protection that just building awareness and education, knowing your rights brings. What are you seeing from the county perspective?
Yeah, definitely. Thank you for having me. I think I want to touch a little bit more in terms of those social supports that our residents rely on, whether they're working or not working. You know, we saw from Dr. Benner just how what the minimum wage or what the minimum income, household income should be. So let me see if this advances. There we go. So as you've seen on the news, there's been significant changes in terms of policy direction regarding health insurance, specifically Medicaid, Medi-Cal, as we like to call it in California, not only from HR 1, which is the federal policy budget, but also from the state. Currently, about 1 in 2 residents in Monterey County rely on Medi-Cal as their full coverage health insurance for health insurance. And unfortunately, what our local managed care plan is projecting over the next 5 years, which is Central California Alliance for Health, is that 27% of our current members will lose coverage because of a combination of both state and federal policy changes. Not only will our 27% of the current members lose coverage, but currently there's about $51 million of economic benefit locally in terms of our healthcare system, our hospitals, community-based health clinics, et cetera. So it's going to have a significant impact on our healthcare system. So what are some of these upcoming changes? So as of January 2026, there's going to be an enrollment cap set. So if you are here with unsatisfactory immigration status, you currently are eligible for full scope Medi-Cal 100% funded by the state. We currently have about 39,000 of our Monterey County residents receiving Medi-Cal under this status. But if they don't enroll before the end of the calendar year, those other individuals that are living in our community, and I think you said there was about 11% of our population is kind of classified as such, they will no longer be eligible for Medi-Cal. And another thing that's going to be happening is the reinstatement of the assets. So this is where individuals are going to have to be able to disclose all of their income, their cash, et cetera. And so that's going to make it challenging for some of our residents to continue to be enrolled in Medi-Cal. As of January of 2027, all of our Medi-Cal recipients, regardless if they're unsatisfactory immigration status or satisfactory immigration status, are going to have to renew every 6 months. As if our systems weren't already complex enough to gather the right documents, make sure you find somebody that can help you fill out the application, submit it on the online portal. So that's going to impact about 62,000 of our residents, where they're going to have to every 6 months make sure they're on top of when they get that nice yellow packet, making sure they gather the right documents and submit. And another change that's going to happen is that once you are enrolled, if you have a medical bill from like 45 days ago, 50 days ago, up to 90 days ago, Medi-Cal will pay for it. Starting in January of 2027, you will only have the ability for coverage retro 30 days from the day that your application is accepted and you are enrolled in the program. So that's going to be really significant for many of our residents. And then they're going to instate now this new thing called work and community services requirement. So individuals between the ages of 19 to 54 who are not considered disabled or elderly are going to have to prove that they are working or providing some sort of community benefit at least 80 hours per month. So that's going to be a significant challenge. the Alliance indicates the status, like a third of the individuals on Medi-Cal are elderly. A third of the individuals on Medi-Cal are considered disabled or not fully abled. And the other third are taking care of somebody who is not considered abled. So who does that leave in terms of being eligible to meet this work requirement? And then as part of the state budget in July of 2027, people who are enrolled in Medi-Cal and are that unsatisfactory immigration status are going to have to start paying 30 monthly premiums per adult, which could be very significant for many of our residents. And so what are we doing here locally? So the Natividad CEO, Social Services Department Director, and myself presented and asked to the Board of Supervisors a few weeks ago, and they approved a $250,000 investment, specifically in these three areas, really focusing on getting the word out with the primary focus of making sure for those individuals that are in our community who have unsatisfactory immigration status and are eligible for Medi-Cal, how do we reach into them? How do we support them through the application process? Not without risk, right? Because if they're not known to the system now, this potentially could get them known to the system. And so really pushing messages, really focusing on that one first change. And in addition to the $60,000 that we're allocating from this pot, Natividad has also provided some of their own funding to do some of the billboards that you'll start to see soon if they're not up yet. And then we're putting about $190,000 really focused on that door-to-door community event, outreach, engagement, education, where we're partnering with the Community Foundation for Monterey County and probably 8 to 10 community-based organizations in our community who have trained community health workers or can quickly get CHWs as part of their organizational, who are also enrolled in Benefits Cal, to learn what all the new rules are, learn about how to complete the application, and then strategically deploying all of those community-based organization CHWs as well as county staff throughout the community where we know we have a higher concentration of individuals who would be eligible. Again, really focusing on trying to get those individuals who are not yet enrolled in Medi-Cal to be enrolled before the cap is established on January 1st. And then additionally, Central California Alliance for Health, which is our local managed care plan for 5 counties, also allocated $250,000 to really focus on targeted media messages in the 5 counties that they're supporting. And then next year, we'll also have grant funding available for community-based organizations with community health workers to be able to continue the work of being the individuals that are out in the neighborhoods, the churches, the community centers, et cetera, really educating our residents about the changes in Medi-Cal and supporting them through the application and enrollment process. CalFresh is the other one that we know has been hit significantly. Fortunately, it is now funded, but only through January. So people who were receiving CalFresh benefits in October or were due to receive them should already have their cards reloaded and should have access to that much needed resource to be able to provide food for their families, but it's only funded through January. Right now, we have about 52,000 unique individuals that are receiving CalFresh benefits and about 28,000 cases. So this is like a parent, a child, or 2 children. Again, not only are our residents perhaps not able to access food, but it really has a huge economic impact in terms of our local grocery stores and some of our smaller mom and pop type of corner stores that are really relying on individuals having CalFresh benefits to the tune of almost $10 million. In August. And, the residents with UIS are not eligible for this. And additionally, now certain non-citizen groups such as refugees, asylees, parolees, trafficking victims, et cetera, will no longer be eligible. And so our Department of Social Services is really trying to understand what that means and what other support there could be provided. And so what did our county board of supervisors do in terms of this is they provided a $150,000 investment to our local food bank for Monterey County to really help support. I heard anecdotally an individual that regularly goes to visit that one to some volunteer. He went in and if you've ever volunteered at the food bank, you see that there's all these like racks and racks of pallets of food that it was pretty bare. There was nothing there was hardly anything, just because of, not only the CalFresh elimination during those critical months, but also a lot of other residents not being employed and really needing to rely on the food bank. Currently, just some facts, they serve 160,000 residents per month, more than half are children. As Dr. Benner indicated earlier, our childhood poverty rate is really high in our community, about 30%. And a lot of our community-based organizations rely on the food bank to be their purveyor of food so that they can provide meals to the elderly, meals in the home, et cetera. And annually, they distribute about 15 million pounds of food each year. So 150,000 may not seem a lot, but it's a little something. As Norm was saying, I think a lot of our community agencies and organizations are really looking to see how they could support the food bank to help address, our residents' need for just basic nourishment. And then just to provide some other context, we're really at the tip of the iceberg when it comes to just potential changes. I know Linda, one of our former teen pregnancy prevention coordinators, her jaw just dropped. So I think what we really need, so they eliminated our CalFresh Living program, which is our nutrition education complementary program to CalFresh SNAP Ed, meaning that no longer will there be school-based wellness services. And then they also eliminated our teen pregnancy prevention program. Meaning that we will no longer work with our local high schools to train up peer educators to support this. Fortunately, the health department does have other resources that we're able to kind of transition and pivot to this area, because we've already made these commitments to the schools and to our youth. And so we do want to continue to follow through on that, but we'll see what next year holds. And I think this is just to give us an idea that we're really just at the beginning. We don't know what the next 3 years are going to hold in terms of just continued investments and supporting our residents. And that was my last slide.
It sounds like did we lose Elsa on Zoom? Jasmine, are we good on that end? Okay.
I was able to hear Elsa fine. I didn't lose her, and I'm via Zoom.
Okay. Thank you, Karina.
You're welcome.
Awesome. Thank you, Elsa.
Thank you.
Echo. We're good? Okay. I think we should be fine now. All right. So Michael, we heard from Chris, sort of this underlying economic growth that's really disconnected with profit, really, and really for the people that are making that growth happen in the first place. And then Norm talked about this feeling of fear felt by, hospitality and ag workers that make up nearly 40% of our workforce in our region. And then Elsa just finished talking about the loss of funding and coverage like Medi-Cal, SNAP, and all of these different social services that affect many in our community. What are you seeing with nonprofits?
Yeah, so to help me prepare for this, I reached out to a lot of our nonprofit partners to hear from their experiences. And, what they really shared is there's just so much fear and uncertainty in the community. And it's very real. Families that once showed up to workshops, school events, and support groups, they've been staying home. It's not because they don't care, but it's just because they know there's that potential for them not to come home. And that's very real. One of the parents shared, every day I worry that I leave for work. I may not come home, but I can't stop going. My family needs food and a roof. And that's a real reality these communities are facing. Imagine coming to just this event meant there's that small possibility you may not go home and your family may not know what happened to you. So they're actually living with that. At the same time, a lot of these safety nets that a lot of these communities are used to are really shrinking. Mental health support needs are rising. Legal aid providers are overwhelmed. They were overwhelmed years ago. And now with a lot of stuff going on, it's even further and further. And right now, a lot of our nonprofits, their best tool is to refer them to legal aid. There's just not enough providers at the moment. Food banks are seeing that huge demand and then dramatic increase in food available. And a lot of our nonprofits are being pushed far beyond their original mission to help support these communities. And nonprofits are much more capable and easier to do that than, we'll say, a business, where even though it's outside of their scope, they will change their mission and, be more flexible to support these families as much as they can. And what they're realizing is these families, they're not asking for charity in any way. They just want stability and really that safety net that's always been there on it. So what are nonprofits asking for? One, if they could get some sort of multi-year flexible funding. It's really hard to plan ahead of what families are going to need in a month from now, let alone 2-3 years. Look what happened with SNAP benefits. Nobody saw that coming, and all of a sudden we're in emergency for about a month. So more flexible funding would really help. Investment in their staffing. Nonprofit staff is, at capacity. They're burnt out and they're being asked to do more and more, yet there's less and less funding. So we can invest in wages, mental health support for them, professional development would help them do their jobs at a higher capacity better, and then not take all that stress home every day. And then also cross-sector partnerships is where they really see a lot of success. Food banks, working with clinics, working with schools, working with legal aid, some way to facilitate how do we all come together and really spread those dollars more, because unfortunately there's just not enough, so they need to work together. So what it comes down to is nonprofits, they're filling these gaps that they see more and more, and they just see more gaps happening. And they're just doing it to make sure people just have stability, dignity, and just belonging in the community that they've always felt. And they work so hard to support in many ways.
Can you tell us a little bit, Michael, about how the Supporting Our Neighbors Fund, where does that fit in all of this?
Yeah, so we've granted out 2 major grants from our Support Our Neighbors Fund. One was to the Monterey County Immigration Coalition. And what they're doing is they're bringing nonprofits together to figure out, again, how to support our immigrant communities. So Norm had mentioned that there had been no raids over here in this area, but an example of an email that just came through this morning was a gentleman was actually in Los Angeles who's from Monterey County, and he was detained recently. Mm-hmm. So now this immigration coalition is supporting the family with direct services, financial need, because he was the main breadwinner, mm-hmm. and now he's gone. And that's a reality that a lot of families will be facing. A lot of our families here travel to Yuma, Arizona, So yes, here we may be protected, other areas aren't, and people travel a lot. So they're happy with that. And then also we did another substantial grant to the Epicenter in Salinas. And what they're doing is helping another population that we haven't quite talked about, but LGBTQ+. And they're making sure youth in South County feel safe and protected, because that's been another population that have been feeling a lot of effects of a lot of these federal immigration changes. Yeah.
Great, thank you. So we will have some time for Q&A, but before we go into that, maybe we should talk a little bit about how sort of these underlying trends, right? These policy shifts will continue to evolve and continue to shift. So from your perspective, what can be done now to not just think through, the next 2-3 years, but just down the road, what can be done now to maintain Monterey County's economic vitality beyond, the next election? Chris, do you want to get us started?
Sure.
Can you all turn on your cameras for video? Thank you.
Briefly.
Briefly. There's so many things are being done. It could be invested in and accelerated. One is helping people get into those industries with better paying jobs. Rancho Cielo is represented here, and they're doing amazing work helping our youth at disadvantage get into better paying industries. That still leaves the issue of those industries that are such large employers where wages are low. How do we change that? Well, we've got to be looking at both improving labor productivity. How do we get technology in those sectors, the ag tech, and also technology in restaurants and our accommodation industry, so that you can increase the amount of revenue per employee employed in that area. That's really the way that you raise those issues. But also looking at entrepreneurship, ownership. Alba, for instance, locally is doing great work of helping farm workers become farm owners. Ventures, another local organization. We have a couple people represented on the board here, including myself, who has a whole Futuro cooperative development initiative, really trying to help people become owners, not just employees, and looking at asset development over time. I think those are the kinds of things we can do locally to shift those economic patterns, while we're also trying to look at the broader national issues as well.
Thank you. Lauren?
Sorry about that. I will just add that there's a lot of pressure on developing ag tech for our crops at this point. It is very difficult to harvest a lot of our crops mechanically, but we are working on other parts of the agronomic system, such as weeding, cultivating, preparing fields with autonomous tractors. Excuse me. But the point I want to make here is that because agriculture is so short of labor at this point, we are not looking to displace jobs. We are looking to retrain jobs into new, higher tech type positions. So this offers a growth to those who are working in agriculture currently and assures them that, we're not out to replace them with mechanical harvesting or other mechanics. Ag tech's going to assist us in lowering the costs of production, but it's going to have to keep that labor force in place.
Elsa.
And I think what I will add is that, we need to continue more of these cross-sector collaborations, both public, private, nonprofit, to really assure that individuals who are supporting our residents have the latest information on the changes that are being implemented or being proposed to be implemented, so that these CBOs that have community health workers who are seen as trusted leaders, as people to go to in the community, have the latest information and can link and support them. And I think, during COVID, we had a great partnership through our VIVA efforts, and we're really just continuing to build upon that and really addressing, the changes that are going to be implemented because of state policy changes. I don't know if you saw the coverage yesterday. The state's projecting an $18 billion deficit. So who knows what other changes the state may be proposing alongside with the federal administration. And so I think just continuing to lift up those public-private partnerships and identifying other partners and stakeholders that could be part of the coalition that is really equipped with the information and can support our residents where they are with the resources that they need. We need to continue to lift up that and expand our reach.
Great, thank you. Michael, anything to add?
Yeah, I think for me, it just, we naturally assume nonprofits are going to support, our residents and our neighbors whenever they can. So we really need to fund them that way. Do you want nonprofits to really focus on fundraising or supporting the community? And I think that's a big thing just to keep in mind. We really need to get funds out to our nonprofits as soon as possible.
Thank you. All right, so now I don't know if we have any questions online or here. We have just a couple of minutes for questions. Yes, Dan.
One is just a little bit of an update. We've had 2 donor advisors make $50,000 grants to the food bank, and then the food bank's at $112,000 for Monterey County Gives. So there's at least as of now a couple $100,000 of support for the food bank. Norm, I guess my question's for you. I actually have a couple of them, but I'll just start with one. Anxiety levels were so high in January, February, March, especially in the farm worker community, trying to understand what their rights would be. One of our first grants passed through, went to the Watsonville Law Center, who we were they were overrun. They just could not keep up with the demand for people seeking their services. Is there any way to sort of gauge if are people less anxious now, or are they just trying to remain vigilant? I mean, as we try to deploy our resources, we want to make sure we're getting them where it's going to have the greatest impact for these affected communities.
Well, we are remaining very vigilant. We're watching this, and I have to say, every day when I read my news feeds, it's changing. So we have to watch and see how this is all evolving on an almost daily basis. I think the community has come to a level where they're still concerned, maybe not as fearful, but still concerned about what may happen. And part of the success that we had there was getting a lot of information out very quickly in that first 3-month period. And particularly to the landowners and the farm operators, so that they know what their rights were and how to protect their property from any type of enforcement. I think We were also very fortunate that we did not have a large workforce in place during January and February, that they were coming back from the desert in March. And so we had the opportunity to reach out, particularly to the farm labor contractors, to make sure that they understood that we are on top of it. If they need information, they can certainly reach out to us. Just like any other nonprofit, we were overwhelmed at the time too. I mean, we're a small staff at Farm Bureau. And so we were overwhelmed by taking this on and working through it as best we could. And so it was quite a commitment on the part of our board to commit all the resources to this also. And I'll just mention that if anybody needs more information about anything that's going on in agriculture, our website has a lot of great information about what's going on locally here in the farm system, as well as our ranching community. I invite you to look that over, and if there are questions, there's ways to reach out to me on the website for more information. But I think we've stabilized the situation at this point, but we're still very vigilant.
All right, Lorraine.
Thank you. Hi, my name is Lorraine Iglesias, and a question for Norm. I'm curious to know about the H-2A visas. Wondering how much more acceleration could the ag industry do to get more of those visas to the individuals that are residing in our county with unsatisfactory immigration status? How can we make sure that those individuals get the documentation that's needed? Because you said there's a labor shortage, right? So how do we get that documentation into the hands of the individuals so they are here fully documented and not have to be anxious?
So this really goes back to our broken federal immigration policies that we have. H-2A is a temporary worker program that brings those from other countries into our area for 8, 9, 10 months of the year, and then they must return to their home country after that point in time. We cannot use H-2A to legalize those who are already in the country. It is a guest worker program. So where we're falling short on our immigration reform is that we're not recognizing that we have 11 to 12 million people here in the United States who we have allowed to come into the country because our system is broken, and we must take that responsibility. Our organization's been advocating for almost 25 years to fix this loophole and provide that documentation, not citizenship, but documentation so that they can stay here and they can also cross borders without having fear. So unfortunately, H-2A won't solve our problem for those who are here in the country right now.
Okay, H, we'll do maybe 2 more here and then online.
Okay. Yes, I know you and Norm talked about increasing the amount of tech in the various mass employment industries to increase its revenue. What are your plans to ensure that that revenue increases the compensation of the working class?
Well, as I said, we're going to retrain those individuals in agriculture. We're not looking to replace them with tech. We're going to retrain them, and that means higher skill levels, and that probably means higher wages for those skill levels as they accomplish that training. So that will come, I think, as a natural, I want to say organic system through the actual training of those employees and retraining them into new positions.
The thing that I would add to that is that one of the charts I didn't show is that as it's about unionization. As increasing inequality has happened in this country, the percentage of the workforce represented by a union has declined. We have a broken industrial relations system in this country, and that's a longer conversation. But part of it is thinking about how do we get the voices of agricultural workers recognized and heard. And that can be through labor unions. It can be from some of our community organizations. Again, we have many nonprofits working with farm workers throughout the county. And that the compensation and support can happen in multiple different ways. Some of it is the increased training and investing in that. Some of it is housing and making the housing affordable. And some of it can be in the form of wages too.
Thank you.
Erica?
I remember during COVID, there was a real need for direct financial assistance to families. Are we at that point now where families are needing that direct financial assistance, and will that list fund support those efforts?
Yes. So with the Immigration Coalition, part of the budget they put out, they received a $100,000 grant. A large portion of it was for direct cash assistance to families. So yeah, and as we further grant out, that's definitely going to be there because I don't think any other funders at this moment are funding that. So it needs to be supported.
What's the lead agent?
Action Council,
Thank you.
along with CVDIO also.
Okay.
Maria, do you have anything online? Louis?
Good morning. My name is Louis Diaz-Infante, Chair of the Board for Siembra Latinos Fund. I recently received a phone call from Mayor Ana Velasquez on behalf of Senator Caballero asking me about food programs. So I also got a phone call from Kristen Coates, CEO of Regenerative California. What we're looking at is to establish a food box program. I reached out to the executive team at Vallarta Supermarkets, and they'd be willing to support a food box program with providing food at a wholesale price, or even having some of the vendors donate food products. So there are other options available out there. Then it's all about funding. Having funding available, a program can be put together fairly quickly to address the issue with food insecurity. And you're welcome to reach out to me, and I can explain more about what we're thinking about doing. This would be through Regenerative California and Vallarta Supermarkets. Thank you.
Sorry. Anything else, Maria, online? All right. Well, thank you all. We appreciate all of the information, and obviously, part of today. Oh, we do have one more. Okay. I can't see who it is. Esther. Oh, Esther.
Yeah, Hester.
Oh, Esther.
I'm sorry. I think my background makes it hard to see my hand. My name's Hester Barker. I'm the executive director of Everyone's Harvest, and I did put a comment in, but I just wanted to point out that Elsa, I think, was mentioning the impact of SNAP on local small scale grocery stores. We run, Everyone's Harvest runs 6 farmers markets, all of which take SNAP, and we have a matching program. And that was those farmers, those small scale farmers that depend on it. Many of them are Alba grads. They were impacted. So we were basically giving out $45 a day to anyone who'd had nothing on their SNAP cards, and they were able to buy produce from local farmers. So just making sure that I know that the food bank, that was wonderful, and the food bank is having to take the majority of the impact, but there are other organizations, and I'm sure you know of them, that are also doing a lot of outreach in terms of creating opportunities for families to feed themselves. And I also want to just ask that people recognize that we can also work on. We also have Medi-Cal patients who can come to our markets and receive produce prescriptions, or produce boxes, like what Louis was talking about. So just making sure that how can we, as other nonprofits in the area who are food security oriented, make sure that people are aware of the opportunities that we're offering people to make sure that people don't go hungry, and they're not all having to show up at the food bank and not have anything. So that's all I just wanted to add, was that we have that. There are probably other. I would love it if we had like a really good clearinghouse for all of the different organizations. And we talked about it at a local group of us, where we're like, who's providing, what are the food pantries in the area? What are the other organizations in the area that are providing food for hungry families? And maybe the Community Foundation has kind of a database like that. I'm just kind of curious. Thank you for your time.
Thank you, Hester. We'll get back to you on that. And we do have just 2 more in the room. We have Nancy and Dan.
Oh, Aaron.
Oh, Aaron, Sarah, sorry, Aaron. Yeah, sorry. Yeah. Sorry.
So I'm Erin White. I'm with Hospice Giving Foundation. And with regard to the question about available funds that we can funnel to individuals and families during this time, I just wanted to let everyone in this room know that at Hospice Giving Foundation, we have a small but new fund called the Care and Dignity Fund, where we can work with nonprofits to funnel funds for food, rent, grief counseling, et cetera, for any family facing an end-of-life crisis that's in need. So all of you and all of us encounter people who encounter caregiver and end-of-life crises. And so we have that available. You would just have to send us an email, and we try to turn that around pretty quickly. And then also just remember groups like Breast Cancer Assistance Group, who offers groceries, gas cards, et cetera, to women who are suffering wage loss as a result of breast cancers.
All right. Dan?
Okay. I would like to ask my boss, Elsa, a question. So we heard about anxiety of going out and being public, but there's also anxiety in declaring perhaps what your immigration status is in order to receive medical benefits. And so I know the CHWs this is part of their education process to try to alleviate that, but just what is your sense of how large of a barrier is that right now in our current environment? People having to sort of like, in order to get a benefit, they have to declare a certain status.
I think it's a very tough situation for our residents to be in, because I think individuals recognize that they probably have deferred healthcare needs that they've really need to get to a doctor, but just that unknown of, I'm not known to the system, or at least that perception that they're not known to the system, and this is going to make them known to the system, could be a huge deterrent for many of our residents. And so our CHWs are receiving training on how to kind of walk through residents through that fear, and really hoping that they'll take that risk, knowing that they're eligible for, health insurance, right? Like it is what many of our residents need to be able to just live a healthy life, to get access to the preventative services, to get access to medication. And so it's a delicate walk that our CHWs are, role playing, being trained by the Watsonville Law Center and others on how to have those conversations with residents. And ultimately, it's going to be up to that resident to determine whether or not they want to take that risk. I mean, that fear of leaving my house and going to work, or as a child going to school and not knowing if my parents going to be home when I get home is real for many, many of our families in our community.
But also, if you dovetail that into Chris's statistics, we're also talking about people that are like the engine of our economy.
Most
and if they are
definitely.
not going to be healthy, then that is going to undermine the power of our economy and their household
Most definitely.
income.
And
Right.
so we're hoping to lift that up, and that be a selling point, so to say, to our residents to, if they're eligible for a specific service, take advantage of it, because that, if you're healthy, your family will be healthier, you'll be able to get a job. And, this administration, we have 3+ years left. I mean, and we've been somewhat left alone, as Norm was indicating. And so hopefully that helps to reassure some of our residents to make sure they're thinking longer term, not just short term, in terms of accessing the benefits that they're eligible for between now and the end of the year, if they're not already enrolled.
We'll look at resources to maybe beef up the CHW program. It's, you've got a big task in a short period of time, and if we can provide any other supports.
Most definitely. I think leaning in on our community-based organizations and community health workers who are individuals living in the communities who are seen as leaders by the residents, bolstering their capacity to further train up their existing CHWs, train others, is going to be critical, not only for riding this wave that we're on, but just connecting individuals to so many resources in our community, whether it's housing, whether it's better employment, whether it's, pursuing their own educational aspirations. I think that is going to be key if we're going to create a healthier Monterey County, is really boosting our community health workers' capacity to be out in the community supporting our residents.
Thank you.
I want to add something to Elsa's comment too. With our nonprofit partners in the CHW program have been very flexible. We had an all-day training on Tuesday. We've had several meetings. Agreements have not even been signed yet. Funding has not been dispersed, but they know how fast we have to do this and set it up. So about 8 or 9 of them have all been committed already, putting in those hours, knowing that we'll get the agreements and funding out eventually. Right now, we need to start that work as fast as we can. So yeah, the Cowell from CCA, he had said CCA, even without the funds, was going to do this work anyway. So let's really get it going. So we really just appreciate that flexibility.
And in order to make this work happen, right? Like, so one of the goals for today was to build awareness, right? Provide information so that you're aware of things that are impacting our local community, both socially and also economically, but then also to learn about supporting our neighbors fund. And you're here today as fund holders or someone that supported the Siembra Latinos Fund in the past. So we know you're philanthropic, you know, you have some sort of emotional tie to meeting need with resources. And so the ask for today, because there is an ask, is for you to consider supporting Our Neighbors Fund. If you're a fund holder, you're familiar with the process, recommending a donor advised grant through our donor portal, or speaking with Brian and Elsa. If you have any questions on how to donate online, we also have a QR code and our link there. And if you have any questions now, whether you're here or online, feel free to email us, reach out to us. We're here to support you and help you make your gift. And we realize that many asks happen during this time of year. So we are grateful for you just showing up and learning and wanting to learn more. And we do encourage you to reach out to us and let us know how to make that next move of sort of, learning and awareness to helping to fuel the resources that make the work of nonprofits possible. So thank you for being here. Also, thank you to the CFMC staff in the back. We have Janet, Anna, Jasmine, Laurel, Elisa, Danny, Maria, Amanda, obviously Dan, and then staff that I know is online. So thanks. Thank you.